What an incredible day of learning for all of us on the 9th anniversary of hosting the Accredited Canadian Ehlers-Danlos Syndromes Conference. Thank you, Lior. And thank you to all presenters for your cherished time, especially on a Saturday, and for your valuable contribution to our event today. Our deepest gratitude goes to the doctors and healthcare professionals who attended in helping to make our conference a successful event. We greatly appreciate the opportunity to work with the Northern Ontario School of Medicine University in achieving accreditation. Hearing and learning from speakers, especially those with lived experience, as well as the attendees during the Q&A sessions, has educated me and all of us here on how Ehlers-Danlos syndrome and related conditions, including myalgic encephalomyelitis or chronic fatigue syndrome, impact daily living for so many. We must stay connected on research updates that can help drive improved clinical care pathways. Staying affiliated with academic experts also helps provide opportunities for advocacy dialogues with government representatives on how they set budgets and write policies for healthcare delivery. The ILC Canadian EDS conference has become a regular event where we all look forward to connecting. It has helped us to have a broader understanding of what Ehlers-Danlos syndrome, EDS, heritable connective tissue disorders, HCTD, and chronic pain are, and in turn has helped us see some changes in this critical area of healthcare. We are confident that the takeaways from this conference will further deepen our thinking and stimulate our planning committee's work for the future. As the event facilitator, it would be appropriate and valuable to summarize some of the themes and ideas emanating from this conference. First, I think the conference has been very effective in meeting its purpose, which is to recognize and identify the illness clusters associated with Ehlers-Danlos syndrome, hypermobility spectrum disorders, and other heritable connective tissue disorders. Further, to express compassion and empathy in healthcare delivery, to develop patient-physician partnerships for improved quality of life, to construct a practical approach for office-based screening of individuals with EDS, HSD, and HCTD, with coexistent conditions of Chiari malformation, chronic pain, gastrointestinal dysmotility, chronic headache and migraine, postural orthostatic tachycardia syndrome, POTS, mast cell activation syndrome, MCAS, atlantoaxial instability, craniocervical instability, tethered cord syndrome, myalgic encephalomyelitis, also known as chronic fatigue syndrome, to describe the best evidence-informed approach for managing multisystemic manifestations in Ehlers-Danlos syndrome and other heritable connective tissue disorders. Second, following these themes for discussions, there were several important and interesting points raised. Dr. Norris and Dr. Gensimer shared their current research on EDS, confirming it is not a benign disease, and as we all know, much more prevalent in women than men. They noted the role of EDS in expanding knowledge about HCTD and what chronic pain is within a hereditary condition, thereby reducing the high cost of healthcare. Interestingly, Dr. Norris also shared that the health challenges in the United States are similar to those here in Canada, and that there is also no funding available, and lobbying has so far not been very successful. Dr. Moreau's presentation today highlights the complexity of identifying and separating the overlapping symptoms associated with these types of conditions and the challenges physicians face in providing an accurate diagnosis or an effective treatment. Much work is necessary to understand why comorbidities such as myalgic encephalomyelitis or chronic fatigue syndrome, fibromyalgia, orthostatic intolerance, and postural orthostatic tachycardia syndrome are so common in the EDS patient population. The symptoms associated with these conditions can be among the most disabling. Dr. Moreau's work in precision medicine promises better treatments and improved quality of life for all affected. Dr. McEwen's presentation highlighted some diagnostic challenges around mast cell activation syndrome, from a lack of physician awareness perspective to the limitations and accuracy of currently available testing. The connection made between MCAS and how fibromyalgia was once also thought to be a made-up condition is one many patients can relate to, and offers hope that with time, this too will change with continued awareness and education, such as you have done today. the complexity of mast cells and the multi-system symptoms associated with MCAS might have stood out for many listening today. The overlap these symptoms have with so many other health conditions that would be more commonly thought of and tested for by physicians, further prolonging diagnosis or perhaps leading to a psychiatric diagnosis when the tests come back negative. We heard from Dr. McLeod that self-compassion is necessary, especially when it is difficult to find support from the outside world. He shared the tools to name it and tame it, feel it and heal it, and be with our emotions will allow us to understand their softer underbelly and meet our needs. Furthermore, staying connected is vital, as we know the ILC community does, recently by sharing patient voices across the country and the ongoing petition to the Ontario government for access to neurosurgical healthcare in EDS and HCTD. All our speakers have expressed interest in collaborating and connecting to increase and mobilize the knowledge to motivate further research for the best health outcomes for this community. We also realize how the ILC matters to healthcare providers on the importance of knowledge sharing in the unique format where learning comes from both doctors and patients. Further, the need to reach and more doctor participation is necessary to benefit from today's event, with a view to knowledge translation and, more importantly, mobilization. We thank you again sincerely for the work you are doing and for sharing it with us today. There were several more specific questions raised during each of the Q&A sessions, which may need further examination by the committee as well, and we will be putting those up on our website and having that available. I want to convey a special thanks to everyone on the planning committee, our presenters, and Lior with Sweet Lemon Productions. Everyone has been extremely helpful in planning and executing this successful event. Now, the ILC wishes you a restful evening, and we look forward to sharing our 2023 educational online series with events with everyone in the next few weeks. Take care.